Excuse me, I'm going to call the meeting to order. Thank you all for being here. I will take roll call. Mary Ann Abadi present, Dr. Ed Copeland, Dr. Terry Giardini,
Here.
Dr. Bill Gorski,
Here.
Dick Cooner,
Here.
Wendy Larson Bennett,
Here.
Tim Neighbors,
Here.
Linda Sanquist, here. Jeanette Towns will not be joining us, as she informed us that she is going back to school and has resigned as our advocate, or I should say advisor. So we will not have Jeanette joining us. And I thanked her profusely for all her involvement, but she's very excited. She's pursuing her CRSS, which will give her certification, and she'll be able to be a rehabilitation specialist in the mental health field. So it's a great opportunity. Welcome also Jason Holcomb and Chelsea Glass. And we do not have our attorney today. So the presenters will introduce themselves before you begin. So I will inform you that we have no public comment today, but the next item on the agenda are the presentations, and the first presenters are from Rosecrans. So if you want to stand and introduce yourselves.
Tell us if we're standing in the right spot. Camera, chair. But how do you instructions? Okay. Okay. You'll have to excuse me because I'm in the age where I need glasses and I don't need glasses, so I do.
Well,
So
we can identify. We can identify.
Thank you so much. So hello, on behalf of the Rosecrans Ware Center Medical Suite and our Access Department, as well as our Mulberry Center, we want to thank you for the opportunity to come and meet with the Mental Health Board. We'd like to also speak about the great work that we're doing, and the work we're doing is made even better by the generous grant funds that the Mental Health Board has provided to us. It has allowed us to both improve our services and expand our services, and we're incredibly grateful for that. My name is Heather Borgard. I am the nurse manager at the Rosecrans Ware Center Medical Suite. I also assist at Mulberry when needed.
I'm the director over at Mulberry. And I'm Jessica Starkweather. I supervise the Access Department over at Rosecrans. So I think you went too far. That's okay. So we're gonna start today's presentation with talking about our targeted population. So we see substance use disorders of all ages over at our Ware Center. We see anybody that is adult age, so 18 up, with serious mental illness, and then any children and youth with a serious emotional disturbance. We provide mental health treatment for those individuals that come in, and then we also provide crisis services for those that are in crisis. And then we have case management that assists with engaging clients to decrease the wait time, helping with re-engagement, and then just overall wraparound care.
And I'm going to speak to our system capacity outcomes. These are outcomes that we're using to measure how well we're using our grant funding. Where can we improve our funding? How can we do a little bit better? So accessibility, our hours of service, translation or interpreter services, the wait time for both utilizing our Access Department as well as our psychiatric providers. More providers, we need more providers, lots of psychiatric providers, coordination of care and awareness, both of the services we offer, as well as mental illness and how that can affect our overall health and well-being. And then we're also looking at individual and family outcomes, and we'll be measuring we've measured for both project year 2022 as well as 23 going forward, persons and families served, symptom improvement, education and employment. So how well are we helping them with those, supporting them in those endeavors, criminal justice involvement, housing stability, and clients' perception of care.
And then obviously the actual services that we provide. So I know Jessica talked about the target and Heather talked about kind of how we're measuring it, the diagnostic evaluations. So both whole mental health assessment for anyone who is familiar with the wonderful world of IMCANs, the psychiatric evaluations, and then the crisis assessments, supportive counseling, so whether that is individual, group, or family therapy, medication management, substance abuse services, walk-in crisis services that are 24/7 over at Mulberry, and then support through the Wear Center as well. Crisis outreach, crisis residential, again over at Mulberry, and then case management. Okay, so now that we've talked a little bit about the population we serve, some of the services that we offer, I wanted to touch a little bit on why it's beneficial to our community in Winnebago County. So we have community clinicians that are able to go out to a variety of community places to complete these mental health assessments. So I named a few up here. We see individuals that are incarcerated. We see individuals that are out on parole, probation. We go to Rockford Rescue Mission. We go to Jubilee, Remedies. So we're hoping to continue to expand that into separate community places and continue serving those clients. We also have our case managers that assist with decreasing the wait time and then minimizing those barriers to get into treatment.
Okay, sorry. So who, in regards to our medical services at the Wear Center and kind of in regards to what we provide at the Mulberry Center, but we at the Wear Center serve clients aged 3 to 21 with serious emotional disturbances and those aged 18 and up with serious mental illness. So schizoaffective disorder, schizophrenia. The Mental Health Board grant provides additional access to psychiatric providers as well as medical assistants and nursing staff, including the addition of evening hours. And let me just expand upon our current staffing right now. So right now we have 4 nurses in the medical suite. This is a big deal. When I started there 4 years ago, there was but 1 nurse and that was me. So I'm now the nurse manager and I have 3 additional nurses, but we have a team lead medical assistant and 3 medical assistants that work with us and a scheduler as well. So Mary Ann, you could probably appreciate how much we've grown, right?
Sitting
Yeah.
here
It's,
thinking,
oops.
wow.
It's fantastic. And we really need those additional people to be able to provide the support. And we do have our psychiatric providers. So we have 2 part-time providers for child and adolescent. We have an opening for 40 hours and we need it. I think we might need even more than that, but we'd like to start securing a 40-hour provider. We're in the process of that. And then we have 3 part-time adult providers and 1 full-time provider. Our 1 full-time provider does share some hours with our Mulberry Center. We do have an opening for an adult provider as well. So we have expanded, we're utilizing different telehealth providers. So we're really working hard to find that need. Luckily, we've got the funds through the grant funding, but it's just finding those perfect providers when you work at a community mental health center. It's a very unique place and we want to make sure we're finding the right providers to serve our clients. Speaking to the additional nursing staff that we have, expedited access to medications through prior authorization process, DCFS consent completion, medication, medical vouchers and samples. So before, when there was 1 nurse, you can imagine it would take a little bit longer to complete prior authorizations or consents. Those being completed are important because the clients can't access their medication if we don't do those things. So when it was 1 person, there's always naturally going to be a bit of a delay. There's only so many hours in a day. There are now 4 different staff members that can work on these. So sometimes we'll get notification that a prior authorization is needed for medication, and that is completed in 10 minutes, which is pretty amazing. You know, we're helping to remove those barriers to care for clients. Medications are an important part of their care. And the same goes for the DCFS consent completion. Medical vouchers, we have grant funding that helps us complete vouchers. We work with our pharmacy on site. So just having the additional staff in place that help navigate that for our clients, we do things so much more quickly and so much more efficiently.
I think you went a
Go
little
on.
bit ahead, yeah.
I think go back 3, maybe 1, 2,
Right there.
Oh, 1.
Go forward too. Right there.
Okay, yes.
Sorry, I had to redo it because the screen share wasn't working on YouTube.
All good.
So then Mulberry, which is actually just down the street from here, is crisis stabilization and kind of that immediate crisis assessment for anyone 18 and up finding themselves in a mental health crisis, whatever they might determine that to be. Our main diagnoses that we can see over there are schizophrenia, bipolar, and depression. We see a lot of psychosis, a lot of suicidality, being able to provide some of that immediate crisis stabilization and getting them more into intensive therapy and then starting seeing the psychiatrist. Their psychiatrist will see them anywhere from 1 to 4 times a week, kind of depending what their needs are, to be able to really kind of hit those meds and get them going. It's a 14-day program to be able to prevent them from going into the psychiatric hospitals, really being able to keep those beds open for who truly needs them, where they might not be able to be community stabilized. And then we do a lot of work, obviously, with the WARE Center and looking at kind of those step-down services. How do we start your next level of care before you leave to prevent you from going back into crisis? So how do we start you with your outpatient therapist? How do we link you with an outpatient psychiatrist? Which, like Heather said, we share kind of Dr. Barney, who it works beautifully because I'm able to say, hey, you saw this doctor here, you're gonna still see this doctor. We'll give you your next appointment, have it scheduled, have it ready to go. So that way we're not risking returning back into crisis.
And nobody's slipping through the cracks.
It's really nice, like the transition of care amongst all the 3 different programs.
So that's you.
Yeah, that is me. So talking about medical staff. So one of the big things that the mental health board did with us was being able to really boost the medical staff that are over at Mulberry. We've had a little bit of difficulty with the nursing shortage, like the whole community is saying, being able to find nurses to be able to work at Mulberry. And so I know with this project year 23, we were able to add that addendum to the work plan to be able to bring in medical assistance. And so we've seen how well that's working over at WARE Center. So I'm really excited to start bringing that over at Mulberry to be able to really actually get some medical staff in.
And now this is my piece, and this is something I'm super excited about and passionate about. So I came from a hospital environment, and we had what we call language cards. So if you had somebody that needed interpreter services, you had an on-demand card. When I came to the WARE Center, we didn't quite work that way. We had appointments, you had to have a reservation with an interpreter. So you can imagine how that interferes with care, just from the very basic, somebody's walking into the center and needs to talk to somebody for help, right? So the grant funding allowed us the opportunity to think big and start looking at other options. And we've now secured and are working with an on-demand interpreter service, which is amazing because now they are there when we need it. Jessica can nod her head along with how amazing it is for access, because access has moved over to like a walk-in process. And so when you have somebody who walks in and needs ASL interpretation, that we don't have to turn them away now. We have an on-demand interpreter service for clients who were coming in for their injections, for long-acting injectables. We have some of them that are Spanish speaking. So trying to coordinate, okay, you're coming in on this date, let me reserve the interpreter. The client doesn't show up for the injection. I still have to pay for the interpreter when it's an in-person interpreter. Now we have an on-demand. So in my opinion, I think it was maybe a little bit more expensive than the service we were previously using, but I'm interested to see some long-term data as to when we were using in-person services before, if the interpreter showed but the client didn't, we were still charged a certain fee. So that was money lost. Whereas with this on-demand service, if the client doesn't show, it's no loss for us in regards for interpreter services, because we haven't even dialed it yet. So it's really exciting.
And to clarify, not that we were turning clients away, but we would have to like schedule them out. So then it was delaying services that much longer. So now they come in, it's like, great, we can see you same day.
So for project year 2022, our award and utilization, you guys are familiar with this number. I'm just going to round it up and say 2.7 million. We're so grateful for that. Our utilization of those dollars was 70%. The Rosecrans WARE Center Medical Services, for the amount allotted to us, we utilized 96% of that. Our access department utilized 70% of that, and the Rosecrans Mulberry Center, the medical services, utilized 27% of that. And I know it's probably in your brain like 27% why. It goes back to what Holly was saying. There is a nursing shortage, and trying to compete with the hospitals or the travel agencies that are paying hundreds of dollars an hour for nursing services, it's hard to compete with that. So, you know, with the COVID crisis, in regards to staffing PRN agencies, mental health facilities, we're down here on the needs. So, the funds, I anticipate those are going to be used much more in project year 2023. And our projected revenue is 1.9 million, and you can see $63,000 of our interpreter services were reimbursed.
Okay, so within the last project year, we had completed 2,453 assessments, and 2,074 of them were referred to our services. So about 79% of those individuals that were referred to services had kept their employment and were engaged in services. To break it down a little more, 803 of them had a serious emotional disturbance, 1,259 had a severe mental illness, and then 12 had a substance use disorder.
And in regards to access to psychiatry at the Ware Center, 621 clients received a psychiatric evaluation. And at the Mulberry Center, 115 clients received a psychiatric evaluation. That data there in regards to evaluation, that doesn't really truly reflect the number of clients served by Mulberry, just because we may have clients that are established already at the Ware Center and they have a crisis, so they present to the Mulberry Center for an appointment, but they're not really considered an evaluation because they're already in our system, they're already receiving care. And the other big piece is promoting care coordination. So our nursing staff conducted 414 care coordination services with outside providers for individuals with intense care needs and to develop discharge planning. We work with a population that has a lot of comorbidities. Some of it is socioeconomic, some of it is created medication side effects. It's just an unfortunate fact, especially with atypical antipsychotics. So being able to be a voice for them and to help them navigate care, which can be quite difficult even for me, for myself, nursing, having the ability, having that extra staff to be able to do that, that number shows how well we've been able to do that. Who's this one?
Well, the first part was kind of what I had discussed previously about the 79% had got that appointment and were engaged in our services that were referred.
And then the next part is me. So in regards to the wait time for psychiatric evaluations, we reduced that by 47% in project year 2022. And that is directly related to having the grant funding to add additional providers. The average wait time is now 15 days compared to the previous 22 days. And this is the other thing I'm really excited about. Having additional nursing staff allowed us to begin holding monthly health presentations in our living room. So each month our nursing staff present a health topic. We kind of try to go by what is like the month thing. So a May month, mental health awareness. So we did a mental health topic, but last month we did burns. The month before that was STDs, which is actually very well received. That's important information. We need to talk about that stuff. So our nursing staff, having enough nursing staff to do that. We have one nurse that really loves to do it. So that's a really important part of the grant funding for us. And then we also have a monthly newsletter for the medical suite, and that has been very well received by clients. It gives them directions on who to call, what number to call, but also little health tidbits, a healthy recipe at Kids Corner. So it's just a fun thing that we've been able to do with additional staffing.
And obviously, one of the biggest, at least I feel like one of the biggest pieces of the data is the clients feeling that they're making progress. So overall, 60% of clients, for whatever they felt like there was their own perception of growth, feel like they made growth. 98% were actually satisfied with growth grant services. 75% reported just improvement in that knowledge to be able to maintain and kind of meet those housing and employment goals. 80% of clients that were involved in the criminal justice system spent less than 1 day in jail moving forward. And then 80% overall kind of felt like there was that improvement in their housing stability, which in our community is a huge thing.
So now for some just fun stories to just help you guys connect with our mission. So as I mentioned previously, we are really in need of child psychiatry hours. We are searching diligently. It is hard to compete with private practice, and it is hard to compete with other agencies, larger organizations. One of the things that we have done to bridge that gap, so we have a kiddo come in to see our psychiatrist. They maybe made a medication change. The psychiatrist would like to see them back in 3 to 4 weeks, but he doesn't have availability. He or she doesn't have availability. So how can we provide them with the best care? So I thought, well, what can our nursing staff do to help? So we've created something called the nurse clinic. So if the provider wants to see Johnny back in 7 to 8 weeks, we will get Johnny set up to come into the nursing clinic at the week 3 to 4. We can assess medication efficacy. We can look for side effects. We can look overall picture, how are we doing? And then we go back and we report to the psychiatrist that information. And then he or she can make a medication adjustment or refer to PCP as needed. We just started that in June and it has gone so well. And I'm really proud of how we are improving our care. Imagine starting a new medication and then having to wait 7 to 8 weeks to meet with your provider to see if it's working. What if it's not working? So this allows us to bridge that gap and provide that needed care.
I'm very excited that we had the opportunity to have community clinicians. I've heard a ton of positive feedback from the community places that we go to. They say that they get excited, the clients get excited, they cleaned out offices for us to utilize. Everybody is just so excited to have this opportunity for us to go over there and serve clients. The clients love being able to be seen where they feel safe, where they feel comfortable. And then just being able to continue to work with these community places for the overall wraparound care for these clients.
Then from Mulberry, I wanted to share just, we have a lot of good stories, but we had one client in particular who made such significant progress while he was there. He was in his 60s, he kind of shared he's never not felt suicidal. And so being able to be at Mulberry really find stability. He shared that for the first time that he can ever remember, he's not having suicidal thoughts. He had a lot of comorbid medical stuff, a pretty uncontrolled diabetic, being able to learn how to control his diabetes, make better health decisions, and really being able to have that better medical step forward after Mulberry. We helped him while he was there really coordinate some medical appointments, learn about how to take care of his body. Had some substance use, also learned how you don't put those things in your body. He actually, I just heard that from him. He continues to come into Mulberry and utilize triage and do some of our groups. And he actually just got into Harrison.
That's it. That concludes our presentation. Thank you so much for listening to us. We welcome any questions.
Thank you.
Thank you.
Question, this might be unfair. Wendy, I'm going to yield to you because of your time in the state's attorney's office. Right, if you can answer it. You do stuff with criminal justice, correct? Okay, you know, okay,
Our TIP program.
okay. Come January 1, you know, there's going to be a lot of criminals released out of our county jail. Are you anticipating, or are you preparing for anything of that nature? Will
That's
that
a
happen?
great question. I'm not sure. I have to speak to Jim Noe, who's in charge of our TIP program, director of that program. That's a great question.
Are you referring to like the no bond release?
Well, they're going to release a lot of people who are in there right now.
Yeah. And so I know just in our circle, there's already been a lot of conversations happening about like, how are we preparing for this? Like Heather said, it's Jim Noe who's kind of heading that up because he's more involved in those court systems than we are. But I do know conversations have been happening.
Well, let me follow up, let me back up a little bit, because, you know, right now we are funding crisis response in the police, sort of criminal justice sector. And there are evaluations preliminarily going on at the jail. Are you interfacing with the crisis response team when people are before people are getting released, you know, and getting them set up in services?
Yeah, so I know Paul Cassiel, who supervises our CCRT, which is the clinicians that work with the police. So I know that his team, for individuals who end up incarcerated, they do follow up while they're in jail. They set up services while they're in jail. That's where Jessica's doing some of those assessments before they get released. Mulberry will often get used kind of if we're continuing to stabilize mental health as that kind of step down. And then obviously the goal is to prevent them from going into jail in the first place. So
Right.
CCRT will often bring those clients to us if they're responding on mental health calls to be able to kind of help stabilize before we can get to that point.
So within your organization, you're doing more talking amongst yourselves about this population?
Yeah.
Excellent.
Thank you so much.
Is it?
Great
Great.
presentation.
Yeah.
Yeah,
More questions. Why only 12 people responding to substance abuse stuff?
Do you mean the assessments? Is that the piece?
The
I think it was-
diagnosis,
Yeah,
I believe it was the diagnosis speaks of it.
Yeah,
So right now, I'm talking with the substance use director on that side of things to talk about cross-training my staff and access so that they are more comfortable diagnosing substance use disorders. They are learning about ASAM criteria in clinical formulation. So we're working on currently trying to cross-train them so that they have a better understanding and confidence in diagnosing those.
because that's such a huge, you know, that you
it's
mental illness, substance abuse.
To go along with what you're
it's,
saying,
You know,
oftentimes we refer clients to our Harrison campus. So that's like our Rosecrans Harrison campus does address the substance portion of it, but we're trying to marry those things a little bit better, not be so siloed. We're trying to improve communication and look at providing certain services at the Ware Center as well. so that because you're right, there is so much of that dual diagnosis.
Yeah.
But don't you still have to do 2 separate evaluations?
Yeah, and that's what I was
For the
gonna say,
state,
is that it's
yeah,
not that the clients aren't there, they're still at the Ware Center, they're getting served, it's the
Yeah.
fact that they have a primary mental health diagnosis. And like Jessica mentioned, her clinicians are working to be trained to be able to provide that secondary substance use diagnosis. So right now they're there, they're just not coming out because they don't have a secondary substance use diagnosis.
You have to use a completely different mental health form to get paid by the state.
Okay, so we need to work on that.
Yes, we just collaborate with the substance use side, like, hey, Johnny could really benefit from this, here's his contact information, you know, we have explained to him he could benefit from this, so yes, it's a whole nother assessment, but we're really working on trying to make that something that we can do at the Ware Center.
Yeah, because that MISA diagnosis is a barrier to treatment on both sides. So, yeah.
But mental health and substance abuse at the state divorce.
Right.
Seven.
Well, we have to, we
They've
have to
never
work
gotten
on
rid of
that.
it. Yeah.
Please, thank you.
I mean, that's our job.
Yeah, right.
How many languages on your language line?
Oh
Are
my
there a
gosh.
bunch?
There's a lot.
So
Okay.
there are any language that you could think of. The only big difference is there's a few of them that they call rarer languages,
Yeah.
and those ones we do have to reserve, which is not, I'm trying to pull up the list in my head mentally, I cannot. So the list, we haven't yet to run into an issue having a language provider.
I know
to
we've
be
used
honest
like
with you.
ASL on demand, we've used Swahili on demand.
I have a Swahili this next week, and I'm not even worried about having that covered. Bosnian, like, we've had many languages come through, we have not had.
And a lot of the Southeast Asian languages are
Mhm.
spoken in our
Yes.
community.
Yes, we have not had a problem with getting the language that we need.
We have put a lot of money in the crisis services. So do you have data on how we're doing in terms of cutting down the use of emergency rooms in hospitals and the jail?
So part of it, I have to connect with suites, because I don't, like our emergency rooms, I don't know exactly what their data is. I know data on our end, I know we've had an increase in admissions and length of stay over at Mulberry. So I would kind of jump to that, I guess I'm gonna jump to that conclusion of with our stay going up and our admissions going up, that theirs would go down. But I would have to really connect with those ERs to really check their data. But I can definitely do that.
Is the fire department bringing people directly? Okay.
So I will often get called, whether it's by fire department and maybe they're in the emergency room and they feel like they need stabilization. So then any of the emergency rooms, either they'll cab them or fire department will bring them over to us. 911 dispatch will call me a lot and say like, hey, we're responding to this call. So what they're reporting, we bring them Mulberry. So there's a lot of clients that are kind of skipping that emergency room altogether.
Awesome.
So while you're having trouble with nurses, is Mulberry now operating 24/7?
Yep, Mulberry is still operating 24/7.
Okay,
We really utilize Heather and her team a lot to support us while we're trying to hire more nurses and medical assistants. But it's still 24/7. So whether it is a walk-in crisis assessment over on our triage side or that crisis stabilization for that 14-day program.
so assertive community treatment, is that what you're kind of talking about with sending counselors out to various other agencies in the community?
So I'm talking about the access clinicians, so they go on site and they complete the mental health assessment, which then will link them into services, whether it's sending them to Mulberry based on needs, whether it's connecting them with outpatients, community support team, the ACT team, and then after that mental health assessment, they can also connect with Heather's team. So the mental health assessment is really what gets
You're
them
doing
into
the
those
assessment, the
services.
assessment piece is the issue you're worried about.
Yeah.
Yeah,
Okay, all right.
Yeah.
And that's what you're describing in terms of wraparound services.
yes, working with
Have to
those
do, okay,
communities.
with engagement.
Yeah.
Okay.
Do you anticipate reducing the wait time more for access to services as you
17
get
days,
more?
can you get down below
So kind of
17
a
days?
two-parted question in regards to psychiatry time. It is definitely a goal, absolutely. I would love to, for a very short period of time, we were like at a sweet spot where we were sometimes scheduling clients for an eval the next day, like magic, like
Right.
amazing services. a matter of finding those right providers who can provide us with the hours that we need. So that's been the struggle. I would love to reduce that wait time. It is definitely a goal. But it's just a matter of finding the providers and securing. Like I said, it's hard to compete with private practice. It's hard to compete with the larger corporations. And let's face it, community mental health center, it's a niche. You have to be passionate about it. But us standing up here, we're passionate about community. I love where I work. I love the patient population we serve, but it's not for every psychiatrist out there.
And then just, there's a lot of communication between Heather and I too. So Mulberry has so many hours of psychiatry that's dedicated to it every week. And if maybe our census is a little bit lower that week, or maybe the clients that are in the unit right now maybe aren't quite as complex, or they don't need 4 visits a week, I can easily tell Heather like, hey, I have 5 extra hours.
And then I say, yes, I'll call 5 emails. Let me get them in. So, yeah, we do our best to try to make sure we are getting people in as quickly as we can.
Thank you.
Thank you.
Okay, thanks so much.
Thank you.
You're so welcome. Thank you for your time.
Yes, very good.
Thank you, appreciate you being here.
Okay, we have another presentation, and it's the Youth Mental Health System of Care, a coordination, and I know Pam is here. How are you, Pam? And
Hello.
Yeah.
It's great to see you. And thank you for the opportunity, the invitation to present to you on the progress that we're making on the youth mental health system of care. Maybe to run you down memory lane, and Mary Ann, you'll relate to this, give you a little bit of history that, well, first of all, I'll introduce myself. I'm Pam Park Ridebuck. I'm a project facilitator. I work for NICNI. We're facilitating this initiative. Also Christina Reddington. She's the hired staff for this particular grant. She's our system of care navigator. And Joe Cruel was with us this morning planning to come. He had a family emergency. And so he is not able to join us, and he sends his apologies. So, but as bringing you down memory lane, Mary Ann, remember back in 2018 when we drove into Chicago in a torrential rainstorm to make a presentation to the Children's Healthcare Foundation.
I sure do.
And our hope was that we would be chosen to help get a planning grant to create a comprehensive plan for a person-centered system of care for children with mental health disorders. We were one of 8 finalists. We were extremely excited about that. We had a second visit with them, but we weren't selected for the planning grant because we were not far enough down the planning process. So we learned from that lesson, right? And the group was so incredibly devoted to this particular issue that we continue to meet despite not getting awarded the grant. So we continue to meet. We applied for a small grant for the Community Foundation to help us sustain our work. We received that grant. We're grateful for that. And through our dedication, through the time committed to that process, we were then about a year later granted a 4-year grant from the Children's Healthcare Foundation. And so there's a lot of lessons learned, I think, from that particular experience about persistence, commitment, and being ready and planning in advance. So, can I go back? Okay, so we'll stay on this one. I just want to share with you the goal of the youth mental health system of care. So our goal was to analyze our current system of mental health care for youth, including gaps and strengths in service provision, in order to create a new coordinated, integrated, comprehensive system of care addressing the mental health needs of our community's children and adolescents, ages 0 to 21 in Winnebago and Boone counties. So our planning team, if you want to go to the next slide, Jason, thank you. Our planning team, we have people that float in and out as with all community collaborations. These are the core members who are coming consistently to help us work through the various pieces of this project. We continue to meet throughout the height of the pandemic. We were meeting online, but we have found clearly, like I'm sure you know, there's nothing like in-person, face-to-face getting together in order to make real progress on this in this work. So United Ways at the table, Crusader Community Health, Rockford Public Schools, Regional Office of Education, Children's Home and Aid Society, Winnebago County Health Department, Youth Services Network, Alignment Rockford, Rosecrans, and NAMI. So what I'm now gonna do is I'm gonna turn it over to Christina, who's gonna share some of the projects that we've been working on, and then share some information on how we think we could work together in the future.
All right, so these are some of the current projects that we are working on. First, I'm going to touch on community of practice, so you can go ahead and advance. The goal of the community of practice is to provide evidence-based training in a collaborative learning environment. So kicking off later on this month is the PracticeWise pilot cohort. We currently have 17 clinicians signed up for that. We have clinicians from Rockford Public Schools, Children's Home and Aid, Youth Services Network, and Rosecrans that are going to be working together with the experts from PracticeWise. They're going to learn how to utilize the PracticeWise as a tool in their daily practice. They're also going to deep dive into specific topics that they see the most with youth in our community. And so then they'll be able to kind of network, create this collaborative learning environment, and work together with PracticeWise to figure out how to best treat those clients. Another thing we're doing, we want to create additional cohorts, not just through PracticeWise, but so we did this clinical training survey. We got 62 responses. What we did is we sent it out to various clinicians throughout the county. We wanted specifically clinicians, not their supervisors, not random people, just the clinicians to be able to weigh in on what's most important to them and what could they use the most training on. So as you can see, attachment-based issues was number 1. And then we had psychosis and traumatic stress also were in our top 3. This survey is still open. We are still trying to get some feedback. It's been open for about 2 weeks now. So once we decide to close the survey, then we're going to try to get experts to come here and to train them specifically, and not just the one-off training, but just to kind of create this cohort, follow up with them after a few weeks or after a month, just to see, did you try any of these new practices? How's that working? So that's what we're doing in our community of practice. You can go ahead and advance. Next up is the IRIS Referral Network. So this is a web-based referral tool. And what we really wanted to show you was how much it is already being utilized in Illinois, and it is definitely growing. So we did get this information from the website here. I encourage you all to go there and check out what is happening in Illinois with the IRIS Referral Network. So basically each agency would have their own profile. They can keep track of the referrals that they're sending out and the referrals that they're sending in. And they also can have the choice to only send referrals or only receive referrals, depending on the services that they offer and their clients' needs. I know we only have a 15-minute time limit, so I can't go into it too much, but there is a 5-minute IRIS demo video that really shows you how IRIS works. It's very user-friendly, and some of the other people in our grant, we're the 3.0 cohort, they've really had a lot of success, and they really have nothing but good things to say about IRIS. So we're really excited to implement that soon. There one other thing I want to say about IRIS? Sorry. Oh, the data. So another great tool of IRIS is the data that they provide at the end. So we can see who's sending the most referrals, who's receiving the most referrals. And I feel like this could really help us in decision-making and allocating resources. So we can go
And
ahead.
IRIS was vetted by the IT experts at Rosecrans to make sure that it meets all the standards as well, especially as it relates to confidentiality.
Yes, it is HIPAA certified. So another one of our big goals is engaging people with lived experience. We have had a lot of success with our youth engagement steering committee. What we did is we partnered with a local youth mental health support group in order to help them guide our work, because they are the voice. So I did give you all a copy of the community support system framework. I'm sure that's familiar to you all, and thank you, Dick Lunar. Yes, thank you for that. This is what guides a lot of our work. So I do have it linked there on the PowerPoint, but basically we have asked them to take a look at it and just decide what is most important to them. And then we're going to go through it topic by topic according to our youth engagement steering committee. So last month they did discuss treatment and rehabilitative services. And so what we did is we talked about gaps in treatment, some of the successes they've had, and we're just really trying to be solution focused. What can we do? How can we improve it? how can we advocate for you, things like that.
What does optimal look like?
Yes, so, and then next month, they decided that we're gonna dive into crisis response services and infant support. So that will be next. Another way we are engaging people with lived experience, we really tried to reach out to caregivers who have youth that are navigating the mental health system. We didn't have much success. We were trying to do monthly Zoom meetings. Nobody was showing up. So we tried to get creative and we thought about doing these quarterly input sessions. So basically, we're gonna tell them what the topic is. Instead of it just being this broad, what do you have to share? We're gonna talk about treatment and rehabilitative services at this quarterly input session. Please come join us. Please tell us, you know, the strengths, the barriers, you know, what we can do better. So we're really hoping that that will garner more participation, a little more excitement around it if they know what specifically we're talking about. So we are hoping to kick those off in the fall.
And it's with incentives.
Yes, oh, I forgot to mention the incentives. The youth and the adults get $30 gift cards for every hour that they participate. So we want to compensate them for their time. And we do promote that on the flyers, and we will be creating flyers for these fall sessions.
Is it in person or is it virtual?
We tried to do virtual for the ones that were not successful. We are hoping these will be in person, maybe more like a town hall.
The go-to people.
We have talked about some of the barriers. We've talked about providing food and childcare. We're kind of trying to work out some of those hiccups. Who could provide that childcare, who's certified, background checks, all of that. But we're trying to get creative and see where it can guide us.
And we recognize that this is a critical part of this process. We commit to the concept of nothing about us without us. So we want to make sure that we engage people with lived experience to inform the process. And it's been slow and the pandemic didn't help. So, you know, we've said to U of I, who are working with research, bear with us because this is a critical piece and we're not willing to sacrifice that through the process. And they are, and they're very comfortable with it.
Yeah, and it is an issue all over Illinois with all of the grantees. So we've taken some advice from them, how to get creative. We're trying to think outside the box. Speaking of U of I, so our grant funder basically contracted U of I to do these caregiver surveys. So basically, when a client presents to treatment, it has to be a brand new client presenting for the first time for an intake. We're trying to recruit them to participate in these caregiver surveys. U of I is recruiting them, but we're kind of doing the groundwork for them. It is a 2-year longitudinal study. And what they want to know is they just want to gauge how things are working out for them at intake, at 3 months, and every 6 months thereafter until June of 2024. So currently, we only have the Rosecrans Access Department distributing this survey. And then we have one psychologist from Rockford Public Schools. So that is definitely something we want to grow. We don't want it to only be focused on those 2 places. So we would really like more participation with these caregiver surveys. All they have to do is hand the family the flyer. It is completely optional for the family, and they are compensated with $30 gift cards for every survey that they fill out. And move on to our website. So this is really exciting for me. We partnered with We Are Neighbor Branding. We created our own website so that we can kind of guide people there as far as what we do. Our mission and vision statements are on there. We do have a community of practice tab where we are listing current trainings going on in the community from any of our partner agencies, or even if they're not a current partner of ours, we just want to share trainings with any clinician. So we encourage people to help us list more trainings on there. We also have a partners tab so that we're able to give credit to all of our partners. That same slide that Pam shared earlier, all of those partners. And then we do have a resource page. So it does have the CARES crisis line on it. We want to make sure that nobody thinks that we provide direct services or that we can provide crisis services at all. So it has the CARES line written in red in case anyone has a youth in their care that's experiencing a mental health crisis. And then we have a link to NAMI if they need additional mental health resources. And then we have this resource directory. So this is something we created. This is the very front page of it, and every single one of those categories is hyperlinked. So if you need crisis services, you would click on crisis. It's going to show you all the agencies that provide those services. It is new. We're trying our best to keep it as up to date as possible. So we just, my email address is actually on every single page of the document, so that if anybody finds an error or missing agency, anybody is welcome to email me, because we want to keep it as up to date and relevant as possible. And last month, when we presented our data to you all, you asked how we can collaborate in the future. So what we would really like to see is our efforts sustained beyond the grant. Like we said, this is a 4-year grant. Beginning in January of 2025, those grant funds will end. We would like to continue to see evidence-based trainings provided to the community. Again, if these cohorts are successful, we really think that instead of just a 1-hour training, it would be great to have this networking piece at the end, so that all these agencies can work together. We're really trying to break down those silos and just create an entire network in the community. Also, we're getting ready to launch Iris. So if you all can help us support the community-wide use of Iris, that would be great. It's only going to be as good as the agencies that are utilizing it. So we really want to see everybody on there sending and receiving referrals. And then just continued data collection and analysis. Everything we do is data-driven. So we really want to know where the issues are, how we can help, where we can allocate resources, and things like that. All right, so that's really all we have, and we're open to any questions you might have.
Thank you.
Way to go.
So how will the Iris referral network benefit clients and community?
So we're hoping to benefit the clients by streamlining referrals. So if you come to me and you need 3 different services, instead of me just handing you a business card or handing you a brochure, if you consent, I'm going to input your information into Iris, and then I'm going to send it directly to that agency, and then that agency will reach out to you. And so we're really hoping to, we know that most people presenting do not have just one issue. They might need a food pantry, they might need issues with housing, things like that. We would like to, take that off their plate. It also has the ability for each agency to update. So if one agency has a really long wait list, we can let them know, well, this agency is currently open, this one has a wait list. We're really hoping to work with the client. I don't want to make the decision for you. I want to let you know what I see in the program and then refer you to the most appropriate agency for you and your family.
Any other
Any other questions?
I don't think so. Well, thank you.
Thank you.
very
Thank
much.
Yes, thank you.
Thank you. Great stuff.
Okay. I think what I'm gonna do is change the order of the agenda so that we can get to the action items. I know that Bill has to leave early, and we need to have the quorum
Okay.
vote. So I will need a motion for the July 2022 meeting minutes.
So moved.
Second.
Yeah, okay. Any changes, any discussion? Hearing none. All those in favor, this is no money, this is all right to say. Please say aye.
Aye.
Same sign, those opposed. Okay, moving into the second item, which is resolution number 2022. Second resolution authorizing all the funded programs, the budget updates for the program year 2022-23. So Jason, I'll let you.
Sure, so this is basically the second iteration of budget changes that were dictated by virtue of things, special conditions or follow-up items that we had with specific agencies. The first one is, one of them is for NAMI. We had just recommended to them, I think they just had a misunderstanding of how to fill out their budget. And so they had included a lot of projected revenue in it from fundraising activities, thinking of that as part of their broader operations. And so upon conversation with them, recognizing that we are funding a particular program for them, and that program is not just giving them capacity funds for their broader operations. So they were able to basically update their budget to reflect the program that we are funding rather than having all of the funds for their entire operation. So that's the first one. The second one on the resolution is a budget update for YMCA, in which just in the original budget, again, I think going through the grant, they weren't fully thinking through how their partnership with Rosecrans might play out in a as they're being the lead agency and working with another agency. So they originally had the Rosecrans staff as direct personnel, but as they've sorted through that relationship, have determined that the best way for them to operate with Rosecrans is to have a contract with them. And so the personnel component that was originally in their personnel line item for a Rosecrans staff has now been moved to contractual, and they're gonna have a contractual relationship with Rosecrans, which is actually likely better because it will keep it cleaner in terms of them as the lead agency managing a contract for services with the provider.
Okay, so I am going to need a motion to pass
I would pass
this
both items.
resolution.
It's in one resolution.
Okay.
Yeah, it's all in one.
I second it.
Now, I don't know that, Tim,
Oh, I think Tim did, right?
you asked a question, right?
Yeah, I just
Oh, you
asked that.
didn't make the motion? No,
So I make the motion.
okay. Tim has made the motion
I
for
will second
resolution
it.
number 2022. And I need a second. Okay, Linda, thank you very much. Any discussion? Any questions?
Marianne, one quick question. Jason, the packet said in the resolution, 3 of those funded programs require budgetary change, and you presented 2.
So let me pull it up.
But I'm just,
If I'm missing one, then I will address that.
only 2 were listed in the.
So we have the NAMI, and the YMCA. So it is only 2. Are you suggesting in the resolution that it says 3?
In the
Or
first body of the resolution says, whereas 3 of those funded programs require budgetary change to meet funding amount.
okay, that is an error. So if we could maybe have a motion to pass it with updating the language in the third whereas paragraph from 3 to 2.
Okay, so I need a motion for that.
So,
Kim, made the motion.
second,
Thank you, seconded. And any further, thank you, Bill, for that detail, important detail.
I'm sure I was missing something.
Um,
Sure it was me.
Any other questions? Okay, hearing none. All those in favor, please say aye.
we have the money, it's money.
Roll, yeah.
Oh, it is money. Okay. Dr. Copeland, Dr. Giardini,
Yes.
Dr. Gorski,
Yes.
Dick Honor,
Yes,
Wendy Larson Bennett, Tim Neighbors,
Yes.
Linda Sandquist,
Yes.
Mariana Body, yes. Motion passes. And the third and final action item for today is the systems coordination plan. And Jason, do you want to just,
Sure, so the only changes that we made from the draft were to update the heading of the translation section to include translation and interpretation. We actually had our first Learning Network collaborative meeting with the funded organizations for the new program year. So all 23 lead organizations and some of the partner orgs for the 31 programs that are being funded this year. And we actually put the systems coordination draft out to the committee and had some great conversation with the organizations doing the work, specifically around transportation, interpretation and translation services, workforce development, and reflective supervision as a function of reducing staff burnout. Great conversations. I think there was a sense of embracing this as like, wow, this is great. We're really happy that the mental health board is looking to now not just focus on programs, but to address some of the structural issues that are making it hard for programs to reach their full potential or capacity, such as workforce development, such as translation and interpretation, which Rosecrans talked about today. They're a great solution for that. Some of the smaller programs with smaller budgets don't have a budget for that built into their program. So they love the idea of there being opportunities in the future, maybe for systems coordination functions to improve services across the county. So I'll just add that note.
Okay. So,
I would move that we accept the proposed systems coordination document.
okay, thank you. Dr. Gorski, okay. Any further discussion, questions?
Just have one there. I saw it presented when I wasn't here last time on watching the meeting. To me, I wonder, how do we hold ourselves in the community accountable for implementing plans, coordination plans, and what those outcomes are? Do you anticipate, Jason, regular reporting, as the priorities in the plan are implemented and actionable, that we would, understand what the outcomes of that are?
Yeah, I think we could specify specific outcomes. So one of the ways that this could be implemented is through an RFQ, a request for a quote, on a specific type of thing that we want to fund, and there would probably be specific outcomes that are attached to that. Alternatively, we've already started to build the infrastructure prior to this for measuring system capacity. So when Rosecrans came and they talked about their system capacity outcomes that they're measuring in addition to client and family outcomes, that's something that's dictated by the grants. So we can, for the 31 funded programs that we're funding, we're going to see some degree of system capacity outcomes. Now, that's also limited to what we're funding. The other thing that we've already put in place is the environmental scan, which we do on a 3-year basis to evaluate the system of care, so to speak, for the entire county. And so we already have done that once, and we'll be updating that this year as part of our 3-year strategic plan update. So we'll have our first trend line. And then if we continue that path, we'll have trend line over multiple years. And so I think the theory of change in this would be that as we fund system capacity outcomes, we should see system gaps close as we do that evaluation. Also open to additional suggestions, Dr. Gorski, if you have something specific that you think might be helpful with that.
No, not specifically, although I have one other personal thing that that I'm the referral system component under the coordination plan. Whether it's virtual or someday actually physical, a one-stop shop location for the community to understand the breadth of services and how they interconnect or how we can interconnect with them. I know our presenters last month were talking about, there was a quote in their presentation about how some of our providers don't even know where to turn because there are so many providers providing so many services that ultimately to create something, and a referral system that has an IT platform or actually a physical presence where people can go or understand the breadth of services and understand how they connect in real time, reducing delay, which would increase access and increase presumably positive outcomes. That's kind of a personal.
But Bill, I think it's really tied in with the new 988 concept that, the resources will all be available to the client, at least through the emergency number. That is going to be 5 years down the line, but it probably is something that the mental health board needs to keep their eye on very carefully.
Well, also I looked up this Connect with Iris.
Yeah, I tried to look it up too.
Well, if you do connectwithiris.org.
Connect with that,
Okay. Anyway, it's very interesting. I would want to spend more time with it, but one of the things is launch Iris in your community, build a new Iris network from the ground up. In other words, it appears just from glimpsing at it, that the idea is to engage with other community partners, and a family or an individual comes in, you do whatever you do in your organization, and you can pull up the IRIS network and say, oh, we don't do X, but Chazzy does, or here are the other partners. Yeah, and it says, integration of IRIS with your organization's existing workflow. So that I think is a fabulous concept that I think we're trying to work towards.
Yeah, that's exactly what IRIS is. It's exactly what Dr. Gorski envisioned as, at least on the technology side of it. Now, physical space for that is a different conversation, but on the technology side, IRIS is a tool that allows for each of the organizations to have a virtual space where their services are listed and there's interconnection between the different agencies, and referrals can be made from one agency to another in a HIPAA compliant manner, where then the wait times between can also be tracked. So you start to kind of get a real assessment of what are the percentages of referrals that are closed and actually lead to an appointment, and what is the time frame that happens, within which that happens.
So what role can we play? Because it seems to me when we're talking about gap filling, rather than waiting for someone else to pick up the ball, we can
I
facilitate.
think we should do what we're doing,
Okay.
because, I've been around long enough, that this has been a dream since the 80s, okay? I mean, this is kind of like, I remember the time when the Casey Foundation gave $8 million or something more than that to the state of Illinois in order to do the same very thing that we're talking about. So this is being chased after for a long time.
Oh, forever.
And I think letting it develop like IRIS and doing what we just heard from the youth, so that it's going to come together. I mean, I think we, in this county, we're going to see it come together faster than most other places because of the commitment to coordination and collaboration that we're making. Because that's at our best. That's what we did well in the mayor's task force years ago. When you had the agencies come together on that, at that time, a monthly basis, we had 30 agencies come together every month to talk about what we were doing and how we were going to do it. And so that's what we lost. And I think if we get that back through the various systems that we're talking about here, we'll see it. We'll see it come together. So, but I have the same question though that of course, that Bill mentioned, and that I reckon I counted 9 strategies that are involved in that systems coordination document. Okay, so are we going to? Do you have in mind that we're going to kind of put the checklist up for those 9 strategies and just monitor how it goes?
Yes, and I think we can start with an analysis of who's already doing some of them.
Yeah.
And we can support the efforts that might already be in place, such as the implementation of IRIS. I think it would be detrimental to ongoing efforts for us to create parallel efforts, right? That's not what we want to do.
Yep.
And those that are not being addressed, then I think that in some cases we might play a convening role, such as workforce development. We're not going to start a new college, but we can bring the existing universities and colleges, maybe along with high schools, together to have conversations about the career pathway linkages, potentially, if that's needed. And in other cases, there might be specific things that we say, we know what the solution is, it's just something we have to, a service we need to purchase from somebody. We could, in that case, put out a specific request for a quote on a very targeted service that we're requesting somebody to do and receive quotes and then fund something. that would be my,
It's gonna keep you busy, Jason.
I know.
Couple of years.
Well,
More than a couple.
be a bigger challenge.
yes, it's gonna take more time than just your time.
Yeah.
That's
Yeah.
Okay, so I'm going to need a motion to approve the system of care or the systems coordination plan.
I thought we did that.
Oh, I didn't, that was part of the question. Okay, so any more questions, any more discussion? Hearing none, all those in favor, please say aye.
Aye.
Okay. The next item, we should go back to the monthly activity report. Jason?
Yes, so we've done a few more presentations. Was at an ice cream social Saturday and was able to present more. And, you know, the big thing I just want to reflect back to the board is I think giving those presentations, and I know that it's wonderful when the media covers what we're doing, you know, but sometimes that 60-second snippet, while it's important to get the word out, it doesn't really give the full picture of what we're trying to do. And going out and giving a 15 to 20-minute presentation and engaging with members of the public for 10 to 15 minutes of questions and answers. And it's just, the response has been great. It's been well attended when we go out. We were invited to Wesley Willows, and to their credit, that was the best attended presentation that I've given thus far. They really show up for their meetings. And engaging and thoughtful questions. You know, try to report those, and sometimes it can be after the fact, but we'll always try to make you aware also when there's opportunities that board members want to come out and be part of a presentation or see a presentation. So I'll recognize that first and foremost. And then secondly, in terms of where we're at on contracts, so for the new year, I'm really excited to give an update this month that we've gotten executed contracts with all but 3 of the programs. So all the renewal ones are done. Most of the new ones are done. We have 3 outstanding, and I've had conversations with all of those 3 agencies within the past week, and they're all right on target and very close to execution of both their funding agreements and work plans. So I don't anticipate that we are going to not be able to execute any of the work plans that we came out of the decision-making process, not only wanting to fund, but even with the maybe follow-ups and special conditions and additional asks, I think all of those will be met.
Great, that's great, that's great.
Excellent.
Beautiful.
So at this time, there is no discussion items that I have. So I do have one thing under other matters. I just want to acknowledge Jason and his staff, Chelsea being one, that today is 2 years that he started with us. Exactly. And the reason I remember, because it's my birthday.
Happy birthday.
Happy
Happy birthday. 39.
Yeah, I wish, yeah.
With me.
Yeah, I don't know. But anyhow, the work that you have done on behalf of the community and the mental health board has been tremendous. And I don't know that we would be at the place where I have without your staff and you, Jason. It's been
Oh, you're in there, Chelsea.
2 years, I know.
Interesting.
We've been at it. 2
I
years.
just look at something, wow.
Pretty amazing. So Dick, this is your
Yeah,
time on
this
the
is
agenda.
our opportunity to say, why don't we adjourn?
Can I say something? I just, real
Sure.
quick, I promise I won't take up a lot of your time. You know, it is August, right? Next month, September, and nothing says Halloween is coming like Walmart having all their Christmas decorations out. Christmas. Yeah, so we're gonna see that. So remember a couple of years ago, we did PSAs. And I thought they were pretty good, and we thought, Jason, you and I talked that maybe each and every one of us should do one. And put it back out there. You know, since everybody thinks they got a phone now, and they're the next Steven Spielberg or Spike Lee, because they have a phone that can do movies or PSAs, I thought we should try to do one. You know, like Tim, you being in the funeral business, who wouldn't know how to talk to grieving people during the holiday season, right? And Ed being his ecumenical component, you know, who wouldn't know how to be spiritual if you're a lonely person during the holidays? And each and every one of us brings something to the table. You guys, with what you did for so many years, you know, Bill, Wendy, I mean, look at Rockford University, all that, whatever, you know, even what you were doing before. And I just thought, why don't we try to do something? It's only 15, 20 seconds, doesn't have to be very long. But Jason, if you want to film it, or you have somebody, Chelsea wants to film it, we can do something where if we put it back out there on our Facebook page, on our site page, and we can put them on our own social media pages to spread the word. Because sometimes people don't know that there really is a mental health board in Winnebago County. As you said, you know, it's nice to go to these places, but people still, we're not getting the word out. So maybe something like that. It was just a thought. I mean, you can sit there and go, yeah, right, sure.
I think that's a good idea.
But if we're on, if when like, you know, you being in the, you know, state's attorney's office, there was something you could talk about for like a PSA about coming through the holiday season, you know, about people who don't have anything to do. Why don't you volunteer for somebody who has to work on Thanksgiving or Christmas? You go to work for them. You know, doing something what makes you on the inside, did something good for somebody, makes you feel good on the inside. So anyways, it was just a thought. I've been thinking about the last week or so about how we each bring something to the table.
My recollection of the last time we talked about this was that actually Ed had offered that his church staff had good video equipment and that they could
There you
film
go.
it.
You're right, I do remember
So I
that.
don't know if you and he ever connected on that, but I think that might be a good place to start with conversation. We can help with messaging and like scripts, but we're not set up, we don't have professional video equipment here. And working with the news station last time was good, but they limited the length of it so much that it was, the message was choppy.
Yeah.
And so I think if we record it and then we share it on social media or share it with news stations, that you guys can use this if you want, you know, in a PSA slot. But I think if you can follow up with Ed, Terry, I'm happy to be part of the conversation.
I do remember that now. Thank
Then
you.
if we move forward with that and they can do the equipment, we can help with the coordination of board members and or messaging if anyone wants like a script written.
Might want to start doing it in October, you know, with that nice fall look at the back.
Well, okay, so, yes,
Now you go ahead and
because
do it.
Bill's gotta leave, and I was gonna just get the vote for adjournment.
Oh, okay.
So moved.
Second,
Okay, all those in favor, please say aye.
okay.
Okay.
Sorry, I kept you longer.
In that vein, wait,
Oh,
I just want to say,
thanks,
in that vein, everybody look up Jeanette Towns
Yes,
on YouTube. She has an amazing video that was locally filmed called When Shattered Lives Become Whole, a bipolar story featuring Jeanette Towns. It's an awesome podcast about her lived experience as a victim of bipolar disorder and how it affected her life. It's beautiful. I think it's well done. And she is working with Reverend Copeland and his church on some of these things. But it's definitely worth, it's about half an hour long. I thought it was great, but that in that frame, in that vein.
Yeah, I
Or
just
if
thought,
you're friends with her on Facebook.
So meeting's adjourned, there's no more discussion.
no, you can go ahead and log yourself. Bye, people. Those who are watching.
Okay.
Yeah, I just thought, being that,
that's a good
just
idea.
do something like that. Just-
Sure, sure, I mean, I think it is very good, and I thought they were meaningful, you
Yes.
know.
Yeah,
No, it is, good idea.
like I said, I mean, each and
Guys,
every
we
one.
can't